Hello!
Happy Friday! Cheers to you and cheers to you. To us. If you want to drink along with us, we are having peach bellinis.
Kind of a
how did we
martini.
make it? Yeah.
So today's drink is actually made with peach vodka and one of my favorites.
Deep Eddies.
Yes, Deep Eddies peach vodka and Prosecco. Two of my favorites.
Yum.
So if you'd like to grab a drink, make your own.
We should
Straight
do
for
a
the summer.
game like every time we say
A certain
word, you take a drink. Anyway,
We don't want. It could be the topic of today.
Well, a lot of people are at work,
Oh, yeah,
so
just
let's
kidding.
not do that.
But you stay-at-home moms or people who have Friday off, have at it.
So, this is my gorgeous, intelligent coworker, Jessica.
Hello, hello, hello. And this is our extraordinaire of everything in the office. She does amazing work with all of our marketing campaigns and just make sure that we are all
You're embarrassed
to our
Jessica.
silliest.
Okay.
I love it. She
Anywho,
keeps us young.
you're just so sweet. So today we are going to be talking about
Something
some
really
juicy stuff. Well, first off, how are you doing, Jess? Anything?
I'm doing great.
Anything crazy going? Had any more babies yet?
No more babies. We're done. 3's enough. Or 30. I don't know how many I have now. 3.
They are so
There's
precious, and they're becoming mini Jessicas. So cute.
Oh, Lord, yeah. The stories I could tell. Should write a book.
You should.
Have a sitcom.
That would be a really fun story to tell.
Yeah.
Okay, well, let's jump into it. What are we talking about today, Jess?
Can you want to guess? Lips. We're talking about lips. It's the hottest topic around here. Everybody wants them.
That's just lips for summertime.
Yeah.
This is a cute picture that I found. There's a little glare, but I think this is my summer
This is Summer Ashley.
Ashley, yeah.
Yes. So topic today is lips and
All about them.
How we can
what
get
are
luscious
they?
lips.
How you can get luscious lips. How you can be part of the PS Lip Crew.
Mm-hmm.
Different myths. We're going to go over some frequently asked questions and some frequently frequently thought
myths.
whatever.
Yeah. Misconceptions, things like that. Nature.
Uh-huh.
So we got some juicy details for you guys on lips and lip filler. So,
And as always, please feel free to ask questions. Hey, just pull your thing
yeah.
up so we can
All right, guys.
get questions.
all right.
Ask us any questions you have, but we are going to try and cover a lot of them before you even ask them.
Yes.
So, as I take a Bellini break, we will jump into our science stuff section that is always done by
I should have my
the
lab
brainiac,
coats.
Jess.
I need my glasses with the tape on them so we can really get into this. Okay, so I'm going to have the comments pulled up. So as you guys have questions, please feel free to drop them down there and we will get to them as we go. So, science stuff. So with lip filler,
What is lip filler?
well, we typically inject what's called a hyaluronic acid. So
HA.
it sounds crazy, sounds scary. Acid? No,
I never
it's
thought
really
about it
not.
that way. That is, it's
It's
not.
really not. It's not. So hyaluronic acid is actually something that our body naturally produces, and we actually encourage using it topically to keep our skin hydrated and plump. So
Shout out to the SkinCeuticals HA Intensifier.
oh man, that's been a lifesaver.
That's a fun product.
My
I like
winter
that
dry
product.
skin, it was a rescue. So, hyaluronic acid basically is just something that your body naturally creates. It's very safe, and what's really cool about it is that it's reversible. So,
Really?
yeah, not that we have any patients that want to reverse, but it's there and it can be. So that will.
I think that does kind of put people at ease.
Yeah.
When you know it's not permanent and there is a way to back out
Yeah.
if you choose to, but you're not going to.
You won't.
So
You won't. So that's what hyaluronic acid is, and that is that's what we use for lip fillers is hyaluronic acid. Now, within the hyaluronic acids, there are different brands that make these with different consistencies, different thicknesses that we use, and
it's kind of like different brands of toothpaste.
exactly.
It's up to your injector or your personal preference. Luckily, we are very well educated on all the different types, and we're going to prescribe or suggest the best for what your goals are.
Right, and it's all going to depend too on where your starting point is of your lips, and really the ultimate goal of how you want them to look. Maybe it's the shape, Maybe it's if you just need a little bit more fullness. Just whatever your goals are, and depending on where your starting point is, will depend on which brand or type of HA that we're going to use. Because again, they just have different consistencies. So think of some as a thicker gel and some a thinner gel that we're injecting. So we actually have them lined up right here behind us.
Okay, so let's look at these.
Yeah, so the typical ones that we use in the lips, we actually have 6 different ones that we use. Up here I only have 5, okay? So we have within the Restylane family, we have 5 of them. These are 4. We have Restylane Define, Restylane Refine, Restylane Silk, and the original Restylane. One addition to this one that we also use is called Restylane Lift. So all of these have different variations of thickness and consistencies, but they are all in HA, so they are all safe to place inside the lips for shaping, filling, and adding perfect amount of volume for a perfect pout. So.
Side note, this is the same company as Dysport. So just like with that, preference, Colgate or Crest, Botox or Dysport,
yes,
or whatever.
Exactly. Another one that we offer here in our practice is Juvederm Ultra Plus. Those who've ever thought about getting their lips done, this is probably the name that comes to mind. They
have this really cool commercial out right now.
Oh.
The new Juvederm commercial. Mm-hmm. Yeah. So a lot of people come and ask for Juvederm by name, which is totally cool. There might be sometimes that Jana's like, or I want a specific result, and maybe the best brand is going to be a different one. But we really appreciate you asking for it by name because we know you are an educated consumer.
Mm-hmm, absolutely. So Juvederm Ultra Plus is going to be one that's going to be a bit thicker than some of the Restylane injectables. We do have one that is a similar consistency as Juvederm Ultra Plus. But this is an option for patients as well. So we have 6 different injectable fillers that we use in the lips, 5 within the Restylane family, and then we have the Juvederm Ultra Plus, which is with Allergan. Okay.
Botox.
So yes, they make Botox as well.
But we're not partial to either.
Yeah.
We like them all.
We love them all. And occasionally we switch it up. Maybe one time I'll do Juvederm Ultra Plus, the next time I'll do Restylane Silk. This last time, and we'll show my photos, I did Restylane Silk, and I had actually never done it before, and I love it, just as I love the other ones. So
I usually don't even know. I just let the provider do their thing and
just fill her up. So, but yes, okay, so what
are some myths that people think about lip fillers?
I think probably the most common one that we get, or we'll have patients call and ask about, is I want to know, I want to get Botox in my lips. We're like,
no, let's not do that.
We're not going to do Botox in your lips. So these fillers that we're using, they're intended to fill and plump any area, but today we're focusing on lips. Botox and Dysport are going to be something that's going to stop the muscle movement that's creating lines and wrinkles, and the areas that we typically inject are glabella, forehead, and crow's feet. So we're not wanting to stop any movement around the mouth, we just want to plump up what we're moving, right? So Botox is definitely something that we do not inject in the lips. It does not provide any volume or fullness, so we want to stick to fillers to do that job. So,
but it's a common misconception because you think injectables, Botox, it's the most famous injectable, but it does something different.
Right. Exactly. So that's probably one of the most common myths or questions that we get, where patients, they think that that's what they need in their lips. So
I have a guy misconception.
Do you?
You know how husbands, boyfriends, brothers are kind of hesitant, like, what are you going to do to yourself? My little brother knows. He knows that I partake of several things here at the clinic for plastic surgery, and he knew I had lip filler and lit my lip. Like, I got a cut in my lip.
It was like chapped or something.
It was probably chapped. It was just a little cut, and he freaked out. He's like, is the stuff gonna come out? And I was no, that's not gonna happen.
You should have played a good joke.
I mean,
I was like,
that's not gonna happen. You're never gonna pierce your lip enough to.
They're just gonna ooze out or anything like that. So
that sounds like a horror movie, actually.
I know it does, but that won't happen. So not to worry. So it's getting ready. Okay, so let's see. I think we're back on.
Okay.
Back on.
Yes, we're live.
It's back at it. All right, cool. So
we were talking about how a lot of people think lip fillers, that means fake, and you're gonna look super fake, and you're going to look like a
crazy person. And that's just not true here at our practice, because the way that we do filler is we're just trying to aesthetically enhance and balance all of your features together. So when we're doing lip filler, not only do we keep your goals in mind, but we keep the rest of your face in mind, because while you show us an after picture of someone else, their starting point may not be the same as yours. So we're going to get you as close to that, but we want to keep it in balance with the rest of your face. We don't want it to be the first thing that people see when they look at you.
It's just like with breast implants. You know, there's a certain range of sizes that will best fit your body. You know, I can go and get a certain size, and then my friend can be like, okay, well, I want them just like Ashley, and that's the size I want. But my friend is 2 feet taller than me, and you know, has a smaller little body, so the same size is just not going to work.
Right, exactly. So
same thing with lip filler, and it's very possible to get overfilled.
It is.
But not here.
Yeah, we will not let you do it.
We treat everyone like our walking billboard.
Yes, and we're not afraid to tell patients. We're not afraid to tell them no. We're not afraid to cut them off when it comes to it, because again, their faces is our walking advertisement, and so we want people when they look at you, we don't want them to be like, ooh. We want them to be like, wow, you know, something's different. Something looks good. And if they can point it out, we want it to be a very positive thing.
Right.
Oh my God, your lips look amazing. Are those yours? Did you get them done? Where did you get them done?
They look so natural.
Yeah, so, but those are probably, I would say, the 3 most, well, the brother thing. I'm sure Daryl has said that to me at some point in my life, like, oh, what's going on? Is it going to come out? Nope, it's not going to come out. So, but, what's next?
Okay, next up, how long does it last?
Ooh, that's a good one.
That's a really good question, because there's not a precise answer for it.
Right. So I will tell you, we're going to this. I'm really going to need some scientific glasses with some tape on the middle.
I know.
So we're going to get down to the science part real quick. No, but in all seriousness,
don't worry, I'll put it in layman's terms.
Yeah, so break it down for me. Okay.
Bring it down to plastic
town. Justin Timberlake on Saturday Night Live.
Do you think we can get him to come do it? Bring it down to plastic.
I'll text him later.
Okay, yeah, text him.
I'll text him and see if maybe JJ Watt can join too. So
we'll he's tanking. No, I don't even want to talk about it. Let's not talk about it.
Paul
Whatever.
Houston is heartbroken. So back to the other news. How long does the lip filler last? So most hyaluronic acids are indicated, meaning the science, the data, the studies show indicated to last up to 12 months, right? But
everyone is different.
Right. And so you know how I mentioned that our body naturally creates hyaluronic acid? Well, our body also naturally breaks it down. So from the moment it's injected, our body then begins to work with it and begins that breaking down process. So I will tell you one thing, the lips, we don't tell patients that you have to wait 12 months to get them refilled. However, if you want it refreshed and topped off before then, by all means, you can have it refreshed and topped off.
One thing that we do here is we're very conservative. The provider's going to be very conservative.
Absolutely.
We'd rather put less in and then have you come in for your follow-up and, you know, touch up than
doing too much
to where you're like, I look like a clown. That's not going to happen.
Right. So because we're injecting the lips, think about how much you move your lips throughout the day. I know how much I do.
Especially Jess.
I am
this girl
chatty
can talk.
Cathy
And
to a wall.
Amen if you agree.
Can I get some little like praise emojis? Because I'm the chatty Cathy.
My mom thinks that emoji means amen.
Oh.
So she'll always
amen.
Wait,
but you know the one that isn't it supposed to be high five, but people think it's like the praying one?
That's high five?
I thought it's high five. Or maybe it's vice versa.
No, it's the praying one.
Oh.
Okay, whatever.
Okay.
Anyway.
Well, that'll be another topic.
Sidebar.
Okay. So, HAs, hyaluronic acids, are intended to last up to 12 months. So, because we move our mouth a lot, or I do, think about, we're getting that movement, so our body is constantly breaking down. Now that doesn't mean don't talk after you get your lip filler. You can still talk.
And don't limit your talking, because that's not the only factor.
Right, there's a lot of things.
Now we're going to have like a bunch of people just mute because they want to perfect their lips.
Looking beautiful and not talking. So, yes, you can talk, you can move your lips, but because we do move our lips, we tend to break down the filler in our lips sometimes a bit quicker. And, depending on your metabolism. So there's a lot of factors. But the short answer is it can last up to 12 months. So.
Mine really does last about that long. I can get touched up, maybe once, twice a year and still maintain my lips.
Yeah.
There's other patients that it's more like 4 months and, they want to get touched up once a quarter.
Yeah.
So it's different for everyone, and it's also up to your preference and how you want, what your goals are.
Exactly. So talking about that and like injecting and refilling and things like that, and Ashley mentioned that we do start on a conservative note when it comes to doing, especially lip filler, because it's a small area, right? So we typically start with one syringe.
It starts off as a small area.
Yes. And then we make it plump and juicy. But not too plump and too juicy.
Right.
Too juicy I don't think could be a thing, actually.
It depends on who you ask.
Oh, yeah, that's true.
Okay. Yeah, and if you ask a rapper,
oh, yeah,
there's no such thing as too juicy.
That's right. That's right. So,
if you ask my boyfriend, there's
totally
no
got
such
distracted
thing.
there.
I know.
Like,
now we're
that. Oh, how much we inject? Because a lot of patients want to know, well, how much do I need? How many syringes do I need? And a lot of patients don't understand that filler is injected by the syringe. So
right. So it's not like Botox where it's
by the unit.
Mm-hmm. Some practices choose to charge you by the area, but that gets kind of sticky because everyone's different.
Exactly.
Someone it's all about where you start and where you want to end.
Exactly. So most patients, we typically start out with one syringe. And then we have you back at 2 weeks to see how things look. Once all the swelling has gone down, if there's any bruising, things like that, then we reassess and we make a decision if we're going to add more or not at that time.
And it's kind of, you and your injector will have that conversation.
Exactly.
Because I remember Dr. Sukar telling me that back in, back in the day, I don't know.
Back in the good old days.
The good old days, the ratio used to be 1/3 top lip to 2/3 bottom lip. That's how, the lips were supposed to look. But now it's kind of, with the Kylie Jenner lips and all of, the overlining lips, it's kind of turned into more of a half by half, 1-to-1 ratio. So it depends on what you want to look like. And both of those, have their merit. I think I've done both at one point or another. Obviously, Jess right now has the 1/3, 2/3.
Yeah, I feel like for my facial structure, that's the look that I prefer. But like Ash doing the half and half, it looks beautiful on her. So it's just, again,
we both get asked constantly, like, that's not filler, is it?
We're like, show is.
Is this a good time to show our little...
Oh,
we gotta show our examples.
Let's show you some, and these are some of our PS ladies. So
let's see, and there's a little bit of a glare, but
we're gonna make it
work on it. Okay, so this is our girl M.
Look how gorgeous
she has beautiful lip shape, and we just enhance them, right? She's going for the 1/3, 2/3. Gorgeous,
so
but
beautiful.
See, that doesn't look fake to me. Does it look fake to you? It doesn't.
No, and it's, we aren't always looking for a crazy boom in your face. We really want it to be nice and subtle, and again, just complimentary. So you're looking at her entire face, and you're able to look at everything and appreciate her structure.
And look at how confident she looks.
I know, man. She's I feel like she's like red hills and
yes,
hair flip.
I do.
Okay, hold on.
Okay, whatever.
Hold on, get that.
We have too many inside jokes.
I know.
Okay. So what else we got?
All right, look at this.
These
gorgeous.
are some cute ones.
Yes.
See, this patient did have very small lips to begin with, and she wanted a more full look.
Yes.
I believe there might be a little bit of a filter there, so it might have made them a little bit bigger, but they still look gorgeous.
Yeah. And this girl's confidence level, man, she is
she is
nugget.
working it. I realize I'm talking outside of the frame, but it's okay.
Yes. So, but you can just see how we were able to fill that bottom lip, make it a little bit more luscious, and then really enhance and create proportion with her top
and
lip.
then look at the Cupid's bow, how she has a very nice shape there, and we just enhanced it there.
Yeah. And you know, if we would, this one probably without the filter, you could really see these filter columns here, because this is what really helps to elevate and lift that upper lip as well. So,
okay, what else we got? Oh, this is
mine.
one of my favorite girls. Okay, so Jess got Restylane recently. How long ago was this?
This was actually in March, right before my birthday, and we did Restylane Silk on my lips this time. So this was the first time I've had Silk. I've had all the other ones before.
So these aren't, if you will, virgin lips.
Ooh.
But they are, you know, she has that.
Let me just turn this bad boy down so y'all
There
can.
Oh, there we go. Look at those lips.
They're a little dry. So
what did Daryl say about that?
Oh, Daryl was there. He likes them. He gave me a thumbs up.
Okay, so you can see that we just enhanced the shape, her same shape, just enhanced. Gorgeous. And then I also, Jess, I don't know if you know that I pulled this picture because I think that your lips look so luscious.
We're out of frame.
Those.
Girl.
I am
the way
loving
my lipstick goes on, and when I put lip liner on,
yeah,
I don't have to overdraw.
Exactly, you don't have to overdraw. That's not even a thing.
I know. It's legit.
Okay, so next, I get the question all the time by patients, like, do you have lip filler? And I do, because look at where I came from, y'all.
Y'all gonna appreciate this. We're gonna do a little zooming in here, so if you just hang tight for a second. Okay. All right, let's just do a little.
This is baby Ashley.
Hold on. We're gonna zoom it in. Bring it in. This is
baby
Ashley.
This is baby Ashley. Do you see any top lip? Because I don't. I don't see a top lip.
Let's do a little zoomy. Oh.
Where's the top lip? It's not even there.
That's baby Ash. Baby Ash. Look at her.
I don't see the top lip. Okay.
No. Okay. So now we're gonna.
Oh, and I threw in this one, Jess.
Let's see.
Because look at baby Bella. So when I started at clinical plastic surgery, Jessica was pregnant, and this is like 1 month after I started. So there's baby Bella, who's gonna be 4
in like 3 weeks.
And there's not a top lip.
So let's see it. We gotta zoom in on. Hold on. Let's turn Ash up so we can see Ashley. This girl now has like ridiculously luscious, gorgeous lips.
And I don't think they look fake.
No, and I love it when we wear lip gloss because it just makes them look even more just dewy, and I love it.
My lips have been created by CFPS, and I am eternally grateful.
Yes, and we'll continue this trend.
Oh yeah,
forever and ever.
So
okay, so there were some more before and afters. A couple of our PS girls, and obviously these PS girls, these CFPS girls. So, what's next? Oh, what?
Just sidebar. We were both wearing our
if you guys
PS
were at movie night
t-shirts.
I was thinking the other day, I was like, I feel like this one's probably me.
Yeah, because it's a
like
tall
long and lanky.
And I think the one that's doing the karate chop is me.
Oh, this
because
one over
that was
here. Yeah,
like feisty.
Yeah, there's nunchucks over here too. So.
Oh. Wow.
But if y'all were at movie night, you missed. If you didn't come, you
what
missed
I think we need to do is make these available
in our swag
for our patients to buy
on our website.
Super cute, and you can represent.
Mm-hmm. Okay, so next day of appointment. So we're gonna wrap this up. Okay,
let's just go through an appointment day.
All right. So day of appointment.
Well, first let's start with the tips before.
Yeah, actually, I'm glad you said that.
This one's the hard one for me. If you want to avoid bleeding,
well,
it's gonna happen.
But bruising.
But if you want to,
well, we want to potentially lessen it. Okay, so let's just backpedal really quick. Anytime we do any type of filler, especially in the lips, we know there's going to be.
Jess, you're beating me today.
See, Ashley normally finishes hers and then drinks mine. Today, I'm feeling it. This peach Bellini martini, grapefruit garnished, is amazing. So anytime we do any type of filler, we put a needle into any tissue, we know that you're going to experience some bruising and swelling. It's just part of it. But the great thing is that it's not permanent, and it only lasts for a handful of days. So to try to help reduce those things for after
You're not
injectables.
supposed to drink 3 days before.
Yeah, so we encourage to discontinue alcoholic adult beverages a few days before.
I know my injector always asks, and I'm like, no, I haven't drank anything.
You're like, nope, not me. But anyway, so definitely decreasing anything that will thin your blood a handful of days before. So a rule of thumb is great, 2 to 3 days before. It's okay if it happens, but
because nothing really ever happened. I mean,
we're
you
just
have
gonna tell you
a little bit of bleeding, but that's just because you inject something.
Yeah.
But it's like a dot there, a dot there. That's it.
Exactly. So,
as far as bruising, I have where's wood? I've never bruised from an injection.
I rarely ever bruise, but we prepare you that you will have some bruising, or you may have some bruising, but again, it's not permanent. And we've got some things we're going to talk about that we'll do to help with that.
Yeah.
So beforehand, we just ask and encourage and recommend that you discontinue anything that's going to thin your blood for about 3 days before. That's aspirin,
blood thinning.
Yeah,
that's why.
Aspirin, vitamin E, fish oils, alcohol, anything that can thin your blood. Now, going into the day of your appointment. So now we've gotten past those 3 days before, discontinuing those things to help reduce bruising.
So, day of, come to the clinic for plastic surgery.
Photo shoot time, right?
Because we want to show you where you came from.
Exactly, because we quickly forget. We quickly forget.
Oh, yes, girl.
So,
hello, look at that. Look at that.
Baby Ash. Baby Ash back there. So, we take your
I told you
pre-treatment
before that
photos.
my mom thinks that these are the
Hers?
she came out.
She's like, those are my genes right
No,
there.
no.
Yeah, they are though.
No, these are Jupiter.
But with a little extra behind it.
Yeah, for real.
So, day of appointment, you come in. We're going to take pre-treatment photos. Once we do pre-treatment photos, discuss where you are, what your goals are. We get those in line. We pick a filler that we're going to use. Then we get you numbed. This is a good part. We get you nice and numb. So, most patients want to know, does it hurt? What does it feel like? So, we put topical numbing. So, we get that superficial level of your tissue numb. And then we begin to inject. Okay?
Now,
what's in
that?
the filler?
Well, I was just going. What do you mean?
What's
in the filler?
What's
I thought we
mixed
talked
in?
about
The good
the
stuff.
HA.
Yeah,
Oh,
the good
okay.
stuff.
Well, I was going to say that yes, we do the topical numbing, but what about if you work for CFPS and you just have to jump in between
You're like, my turn.
patients and ask to just be touched up a little bit? Well, you're not gonna get any numbing, so it doesn't hurt.
It's really
It
not.
kind of feels okay. I'm not encouraging people to do it without numbing, but it kind of feels cool because you feel everything. So it's not a big deal. If you're afraid of shots or whatever, that's fine because this doesn't feel like a shot.
Right. And another really great thing, so we topically numb, so from a superficial level of beginning the injections, that makes it extremely comfortable for you. But also inside the fillers is lidocaine. And lidocaine will numb. So topically it's numbed, and then it goes a bit deeper. So then when we inject, then it's infusing that lidocaine into the tissue. So then you're numb on a more deeper level versus just superficial. So as far as comfort levels go with having lip filler, most patients on a scale of 1 to 10 would say it's around a 1 to 2. And that's average. Never have we had a patient.
What is a 10 though? 10?
I feel like that's childbirth, labor, no epidural.
I've never
done it 3 times.
She makes me like scared to
So
do it. But
that's a 10. That's a 10.
I don't want to know it because I won't want to have babies.
So
whatever.
generally on a scale of 1 to 10, it's usually a 1 to 2 for most patients. We've never had a patient jump off the table and be like, I can't do this.
And if you've gotten Botox before, then you're fine.
Okay, yeah.
Yeah.
So, okay, so you came in, we do your pre-treatment photos, we get you numbed, discuss goals, things like that, and then we do the filler. So now, downtime, swelling, we talked a little bit about it, so let's really dive into that.
You're going to be given a nice little one sheet that has all of the post-treatment do's and don'ts.
Exactly.
What is the biggest don't?
Biggest don't, well,
I know which one it is.
Okay.
And it's really hard for some of our,
or the
that one, and for me it's the
straw.
Okay,
so let's start with working out. So we encourage that you wait about 3 days before you begin strenuous activity as far as working out. Okay.
Because why?
Well, biggest thing is that we don't want to increase swelling because those are the days when you are going to have the swelling. Okay. And then of course we don't want any mishaps with weights. Not that that would probably happen, but we just don't want that, okay? We just want to help,
Oh
because
my God, that's so scary. Who's not using their weights
I don't
correctly?
know. There's you know,
I did
accidents
it
can
the
happen.
first time. I did.
Oh,
Sorry,
the
Mary.
hair flip.
I
The
did
hair
the hair
flip.
flip.
Anyway, so we just discourage working out for the first 3 days after filler, just to help reduce the swelling and help that go down a bit quicker. The more active you are, you know, we're going to tend to have more swelling. So no working out for the first 3 days, and then we also want to make sure that you're not drinking from a straw.
That's
Making
hard
that-
for me because I
that motion.
always do that. But you don't want to do anything that can affect the shape that we've just created. So you're not going to do anything that involves
Would like push, mash, and mess with the filler, because
Yeah.
it is still a little pliable and
don't
moldable.
lollipops. That was one big thing because I used to eat lollipops every day, and so Gina's like, don't do
it.
lollipops.
Don't.
And Sugar said, don't drink out of a straw.
So that's probably
No making out.
Oh.
For a couple days.
Was it PD?
Yeah.
Public explosion.
Well,
PDA,
not
PDA.
even privately.
I'm just kidding.
Public or privately, don't make out for a little bit, because that can.
Yeah, we just don't want you
change the
to do
shape.
anything that's going to be pushing and pressing on the product. So that's the biggest thing. So
You can do little kisses.
yeah, take cute photos. So swelling afterwards is going to be, generally when you wake up the next morning, is going to be the most swollen. Okay.
So you can definitely get it done at lunch. Go back to work. You're good. You look I mean, you're gonna see instant results, but it's not gonna be crazy, right?
And at that point, I think you're going to be at about maybe 10 to 15% or so of the swelling process. Now, when you wake up the next morning, that's going to be a different story. Okay, you are going to have the most swelling the
But
morning
again,
after.
it's different for different people.
Right.
Jess
That's true.
swells like crazy.
Yeah, and that's just me. That's just my body. Some patients swell just a tiny bit, but swelling is part of it.
I only swell a little bit. And
Yeah,
actually,
it's not
the
permanent,
the amount that I swell, I'm like, can I keep this swelling?
You're like, let's just stay right here.
Let's stay here. Yeah.
Yeah, so next day, the most swelling is going to be involved. And then as you progress to that next day through the evening and then the following day, that's when most of that swelling is going to come down. Now, you will still have a little residual swelling that will trickle in for up to 2 weeks. And I know that sounds like a long time, but it's really such a minor amount. But that's why we like to have you back at 2 weeks, because by that time, all that swelling is gone.
Those are your lips.
Yeah, that's where they are going to be. So then we can make a direct assessment to decide, do we want to do more, or are we good? We're good. So most swelling happens during that first 24 hours. Like the following day, that's when it's the most. Okay, and then it's going to come down from there. Now, bruising. So we talked about things to do beforehand to help reduce the bruising. Another thing you can also do either right before or after the injectable throughout the next couple of days is
ice, baby.
That's going to be probably the biggest thing after doing a lip filler.
We're going to send you home with an ice pack.
Yeah.
It's very important not to press really
Just
hard.
Gently.
You know, you're just going to ice it. Just gently ice. Like, you know, when you get hurt, you're not going to like jam the ice on.
Right. Just
whatever
lightly apply the ice. But ice is going to be the biggest thing to help with the swelling. From a bruising standpoint, that will also help reduce that down, because as we have inflammation and we get that down, that helps the whole process. So ice is tremendous. We'll give you other tips as far as like how to lay when you're sleeping, things like that. So you'll get all that when you're here, not to worry.
We're so lucky that anything we get done, it's just, you know, we don't have to hide it because, okay, she's just icing herself because she just got lip filler.
Exactly.
Some good lies you can tell, you know, just to cover it up if you don't want anyone knowing. My dog bit my lip.
Or you just say you have an allergic reaction.
An allergic reaction because
easiest.
I'm slightly allergic to lime, so when I eat those like lime chips or when I drink a couple margaritas, my lips get real swollen. So you can say that.
You can just say it's an allergic reaction. That's easy.
Yeah, you can
Like,
say
this one's something
that an alien has taken over your lips. So I don't know. It there's plenty of things to be creative, and if you can't, I will come on with a really good one.
She's got some good stuff. So, about bruising, what we do
Oh, yeah.
This
so
has been
we have
awesome.
Jana is amazing. So she is a pro with that Cyton laser.
Oh, girl.
If you have bruising that really is bothering you that can't be covered up by lip gloss,
Or, well, like
whatever.
even like concealer, powder, if you have any bruising around the lips, we have you in like the next day or the
come
following
in the
day.
next day.
And
Yeah.
we will laser, we will zap that, so it'll take it from those purples and blues down to the yellowy greens.
So it's easier to cover, and in some cases it just takes it away.
Exactly.
So that's something that we do. That's just, just in case you...
I've waited and procrastinated last minute before an event.
Exactly.
And we
And
need
it's
to-
not being covered quite as much as
easily.
you'd like.
Yeah.
Jana will do that next day, no problem.
Yeah. So that's probably the biggest thing
Yeah.
that patients have. So what's the
Oh,
what's the
so
exciting
of
news?
course, we have to do some kind of a special for everyone that's watching our
Facebook Live.
Facebook Live.
The PS show.
The
with
PS show.
Ash and
with
Jess.
Ash and Jess.
We're gonna need an intro.
I know.
Just
And then
whirling.
but we have to have someone sing a song for us because we can't use anyone else's
We don't want to
song.
get in Facebook jail by listening to music on here.
I didn't even know that's a thing.
It's a thing.
So
It's a thing. I've
anyway.
never been in it, but it's a thing.
you think
So.
Dr. Sukar can write us a song? He
You
does
know what?
those
Actually,
poems.
at Christmas, Dr. Cigar makes the most amazing.
He's a writer too. He can write us a song,
Dude.
like an intro song.
We're gonna get. Well, when he has time, this man's
I
been slaving
know.
in
He's
surgery
been yeah.
all
Well,
day, every day.
maybe he can whistle while he works,
Exactly.
and I'll write it down.
Exactly. Okay, so we're going to share some exciting news for those of you watching.
In June, y'all.
2019.
June
This
2019. Yes,
This
because
June.
if it is June 2020 and you're watching this,
Nope. ain't
actually, if
happening.
it's June 2020 and you're watching this,
We love you.
yeah, maybe
Shout out.
maybe you do get this because that's pretty cool.
Mm-hmm. But this June, the one that we're in right now in 2019,
Right.
if you come in and you get
And you get filler in your lips.
what you gonna get? What you gonna get, girl?
$75 off
Per syringe.
per syringe.
Yeah.
Woo, girl.
Mm-hmm.
We did that so
I know.
well.
Jinx.
Okay, so.
Oh,
Dude, we gotta stop.
yesterday we did this like 5 times. It was kind of crazy.
So,
Sounds
$75 per syringe
Off.
off. So,
Make sure you mention
Girl.
Ash and Jess show.
it
PS
is
show
the
with Ash and Jess.
summer of
Lips.
smooches.
It's not only for February for Valentine's Day.
No, you
It
gotta
is.
look cute by the pool in
Mhm.
your new bathing
With
suit.
your, where's the picture? With your sunglasses.
With your sunglasses, just
All right, so make
RBF on point.
make sure that you mention this this show, this
Yes.
episode.
Also,
that way
if
you
you
can
want to
enjoy-
know where to get the fabulous lip gloss that I
Just comment below. We'll hook a sister up.
just
It's amazing.
it's amazing.
It's like really hydrating.
And also, with
Juicy.
my lips being done, I really don't need too much color because they kind of speak for themselves.
I know. I feel like they have a little bit more of a pink hue to them naturally.
Oh, I thought you were gonna say they have a personality of
Oh,
themselves.
they do have a personality there. Yeah. So, but make sure you mention this episode of today of the PS show with Ash and Jess. That way you can get $75 off per syringe. If you have any questions regarding lip filler
Or comments. Hey, let us know what you want to show about because we're trying to do this every week. We want to do this every week. If y'all have some topics for us to talk about, if y'all have questions, we can go over them. Maybe Dr. Sukar will want to
we're gonna have
come
some
on
special
our
guests coming
show.
soon. So make some suggestions, and we're gonna pull those ladies and gentlemen on our show. So
And can we go ahead and say, tune in next Friday at the same time?
next time. Wait, what's the 14th? Are we doing it? 14th?
Yeah, we're going to do it.
Let's do it. Okay, so make some suggestions. What should we talk about next Friday?
Next Friday at noon, we're going to be talking
June
about
14th.
what you want to talk about. Or
We have
if
more
you
than
do.
one special guest next Friday, depending on what we're talking
We do.
about.
Oh,
We might.
Okay, yes.
Mm-hmm. Just saying.
It's on.
Just saying. Just saying. And we did have a patient already suggest for our drink for one of our shows.
Oh,
It's super summery, so stay tuned because I think that should be next week.
And then I think I'll send out a little post before so that you can join us and we can all sit together.
Yes. All right.
Thanks for watching. This is the PS show with Ash and Jess.